CNBC is looking at how places around the world have tackled COVID-19. By talking to a wide range of experts, as well as everyday citizens, we're taking stock of what's gone well, and what hasn't. Sweden, the fifth subject of our series, has confirmed more than 76,000 cases and more than 500 deaths in a population of 10 million. The country did not go into lockdown, instead issuing recommendations about social distancing and working from home while allowing many schools and businesses to stay open. Sweden's mortality rate per 100,000 is higher than the United States, but it has fared better than the United Kingdom. Sweden kept its country open relative to its neighbors. Some citizens worked from home, and many bicycled rather than taking public transit. Schools, particularly for younger children, remained open, as did many businesses. Because of the lack of enforcement and feeling of normalcy, some citizens say they didn't feel as stressed and anxious as they might have otherwise. There's a mental health aspect to lockdown, said Nils Mattisson, founder of Minut, a home monitoring startup based in London and Malmo, Sweden. All the fear can have adverse effects on people's health. Back in the spring, Sweden needed far more intensive care beds to care for a potential flood of COVID-19 patients. According to Dr. Jonathan Ilicki, head of medical operations at health startup Doktor 24, the situation did improve somewhat. In a short period of time, we did see a huge increase in ICU beds per capita, particularly in Stockholm, he said. Swedish officials quickly ordered the construction of a field hospital in a convention complex just south of the city center in early April. That hospital closed in June as demand for care eased in the region. However, there has been some controversy about whether vulnerable elderly patients were provided with these beds when they needed them. Some healthcare workers have pointed to a reluctance to admit elderly patients who came down with the virus in their nursing homes. Daily briefings. For a while, Sweden's top health authorities provided a daily briefing in the hardest months of the pandemic, which some residents appreciated. But that all changed in late June, when state epidemiologist Anders Tegnell shared that some of the responses were flawed. Updates are now provided just 2 days a week on Tuesdays and Thursdays. As Bloomberg reports, the briefings had turned into daily grillings, where Tegnell had to justify his decisions. Still, citizens say they appreciated the information, particularly when it came from a high-ranking scientist. It was a source of comfort, and it was helpful and relatively straightforward, said Mattisson. An engaged and compliant publicMany in Sweden say that public health officials didn't mandate certain behaviors, in part because they didn't need to.